This message is brought to you by Gabe, Ilenda, Zach Foster, and Carson Velde for the Williams Syndrome Foundation. Now you may be asking yourself, what is Williams syndrome? How is it inherited? What are some common effects of the syndrome? And what are some common treatment options?
Williams syndrome is caused by deletion of a few genes in the 7th chromosome. More specifically, the syndrome is caused by deletion of 26 to 28 genes near the centromere of the 7th chromosome.
What's important to note is that in most cases, Williams syndrome is not directly inherited from the parent due to the common tendency of those with the disorder to avoid producing offspring. However, if a parent with the syndrome does engage in intercourse, their offspring carry a 50% chance to display Williams syndrome. On the other hand, it's much more common to receive this syndrome by random abnormalities and mutations in the 7th chromosome of the gametes of the parents. For the syndrome to occur, during meiosis, a chromosome receives a deletion mutation and loses crucial components of DNA. When the gamete, which can occur in both males and females, meets the opposite parent's gamete and fertilization occurs, Williams syndrome will always occur, which means that only one parent needs to give a faulty chromosome for the disorder to be present. For this reason, and by definition, Williams syndrome is autosomal dominant, meaning that if there is one defective chromosome in the offspring, Williams syndrome will occur. Identifying Williams syndrome is usually very easy based off of the unique facial features of those affected, which look somewhat similar to the features of Down syndrome. The Williams Syndrome Association states that some extremely common facial features are a small upturned nose, a long upper lip, a wide mouth with fuller lips, a generally smaller chin, and a slight puffiness around the eyes. As is to be expected, unique facial features are not the only abnormalities in those affected. Many newborns suffer from low birth weight and experience difficulty raising their weights until later ages. A huge part of this is the common development of eating disorders, where infants have trouble taking in and digesting their mother's milk. This low weight usually carries on into adulthood, which explains the weaker and smaller build of most adults with the syndrome. Another common trait people with Williams syndrome experience as an infant is irritability, or an extremely active lifestyle for the infant. This is usually characterized by constant motion, squirming, wiggling, etc., and a lack of sleep during usual hours. However, the children do tend to get over this period in around 4 to 10 months.
Many children begin to experience muscle weakness and joint laxity at young ages. If left untreated, these symptoms could lead to stiffness in joints later in life. However, physical therapy and regular exercise is a healthy and fun way for most to combat these developments, while also increasing the range of motion in younger years. During the more developmental parts of life, most children experience distractions often and usually cannot focus on a certain thing for a very long time.
Similarly, many children are diagnosed with attention deficits such as ADD and ADHD.
Along with attention problems, many basic learned skills are difficult to master. Becoming potty trained, learning to ride a bike, and dressing oneself can be an issue for many with the syndrome. An extreme common one of these issues are speech impediments. However, with speech therapy, many can become much more fitted to have faster pace and common conversations.
Despite the usual speech impediments, being extremely social is common among these diagnosed. This is most likely due to the development of attention disorders. In the United States, about 1 in every 7,500 births carry Williams syndrome. This birth tendency has led to between 20,000 and 30,000 people to have Williams syndrome in the U.S. Keeping the previously mentioned symptoms and treatments in mind, let's take a look in the day of the life of someone with Williams syndrome. Those in school may require special education courses and teachers, depending on their attention issues and learning speeds. Just as many students do, these children will take almost every opportunity to talk to whoever they can. Because of these social habits, many tend to work in more social environments such as community centers and as greeters or assistant workers in stores. Also, an overwhelming amount of work in community service projects. However, because of the need for different forms of therapy, many must take time out of their day to develop these traits. Also, these therapies may not be covered by insurances, which poses threats to the financial services of the families.
When regarding these symptoms, many think that Williams syndrome is not that big of a deal and really only applies to schooling and focusing disorders. However, there is one more common symptom, and it's a big one. Heart and blood vessel issues are found in just about every single one of the 20,000 to 30,000 people in the U.S. with Williams syndrome. The biggest issue in this subtopic is the narrowing of blood vessels, which results in decreased blood flow throughout the body. The two main arteries affected are the supravalvular aortic stenosis and the pulmonary arteries. The degree of seriousness in these shrinkages can vary greatly. Some people experience slight tightenings in the vessels and slightly elevated blood pressure. On the other hand, it is possible to have the vessels tighten to a nearly shut position, leaving the person with extreme blood clots and buildup in certain areas with hardly any blood in other areas.
In people with more serious cases, surgeries are necessary to keep the patient alive. For this reason, the life expectancy of someone with Williams syndrome tends to vary. The life expectancy is estimated to be somewhere in the late 60s, not far off from the 78-year expectancy in the U.S. However, patients' lives can be claimed before their first birthday. The cases vary widely. Make sure to donate to the Williams Syndrome Foundation today. In the near future, we hope to be able to identify the deletion of the genes during early development of humans. With your donation, we may soon be able to identify these defective chromosomes and add manufactured genes to the patient's DNA using epigenetic studies. Imagine a future where the effects of Williams syndrome can be reversed and parents no longer have to worry about such a thing in their children. Donate today.